Hello and welcome everybody to the EFMN 2019 Year in Review Community Forum. I'm Glenn Lloyd, the Executive Director of the Epilepsy Foundation of Minnesota, and I'm glad to have you with us all today to talk about how 2019 was a strong year for us as an organization. We'll also spend some time with our Program Director, Nikki Baker, to focus on 2020 and what we are currently doing during the time of physical distancing to make sure we're all still connecting and serving those affected by epilepsy. First, I want to cover some very basic housekeeping items. All audio and webcams have been turned off other than our speakers. I do encourage you to ask questions throughout the forum in the questions box on your screen. I think it should be right over there. You should have your question box and ability to ask your questions. We'll also be asking a few poll questions throughout the forum, the first of which is about to show up on your screen now and will help us get a sense of who is joining us today. So let's jump in. Poll question is, what is your relationship to epilepsy? Your options are, I have epilepsy, my child or spouse has epilepsy, another family member has epilepsy, a friend or coworker has epilepsy, and finally, I support the epilepsy community. We really encourage you to take part in our poll question. We really appreciate you being here with us today. We're going to keep the poll open for just a few more seconds. All right, so let's go ahead and close that poll. Who's with us today? What is your relationship to epilepsy? So we have a strong support community out there that's joining us today. Thank you for being here with us, as well as those living with epilepsy, either a loved one or a child or spouse, or you yourself have epilepsy. We really appreciate you taking the time to join us today to look at 2019 and review the good work that has happened here within Minnesota and Eastern North Dakota. Now, before we start covering some of the specifics of 2019, I feel it's important to tell you what led to these successes. It's support from you. Support from those who have made a donation, attended a connect group, created a team for the walk, or scheduled a donated goods curbside pickup. Your commitment allows us to empower the fight of those living with epilepsy as they overcome challenges, navigate their epilepsy journey, and gain independence. So thank you for all that you've done for the epilepsy community of Minnesota and Eastern North Dakota, and thank you for being here today. Now, those who have contacted our information services team know just how helpful they are and how they can connect people to the programs relevant to them. It's really at the core of the work we do. In 2019, 106 people joined us at the Minnesota State Capitol to meet with their legislators and advocate for Seizure Smart Schools legislation. The annual Advocacy Day at the Capitol is a time for epilepsy advocates to meet with their legislators, share their story, and support specific pieces of legislation. Thank you to the initiative of advocate Ruth Schmitz. In 2019, we introduced important legislation to the Minnesota legislature. What started as a paper for Ruth's college class became the Seizure Smart Schools legislation that provides Seizure Smart training to K through 12 school staff. Teachers, nurses, and personnel would learn how to recognize and respond to someone having a seizure, an important step in keeping our students with epilepsy safe. In 2019, 159 youth ages 17 and under joined us at one of our 3 camp programs. This includes the week-long overnight Camp Oz, day camp for younger kids to prepare them for attending Camp Oz in the future, and family camp for those with additional needs that can't be accommodated at Camp Oz. Our Shining Stars program grew to include over 400 youth living with epilepsy. This program addresses the feelings of isolation and difference that can often come with an epilepsy diagnosis, especially at a young age. It helps both kids and parents connect with others that have epilepsy and are raising kids with epilepsy. Our two largest events include the annual Shining Star celebration at Nickelodeon Universe in the Mall of America and a Minnesota Twins baseball game where one of our shining stars threw out the first pitch. The next program that I'll highlight, and it's really incredible, is our Seizure Smart program. Our staff trained over 16,000 people through our Seizure Smart trainings. I'll repeat that. More than 16,000 people last year were trained on Seizure Smart in Minnesota and throughout the Eastern North Dakota region. This includes students, teachers, workplaces, community groups, and senior care facilities. Our program staff have done an incredible job building out trainings for specific groups. This means workplaces get the information they need, while first graders are getting trainings that they understand and learn epilepsy is simply one of the many things that makes each of us unique. Making sure people know how to recognize and respond to someone having a seizure is incredibly important for their safety. We know 1 in 10 people will have a seizure in their lifetime, which means 10 in 10 need to know how to respond. Most of these trainings were done in person, but some were conducted through either video conferences or webinars, both of which we are expanding on during this time of physical distancing. In 2019, Connect Groups saw a total attendance of over 700. This comes from 73 different meetings from across Minnesota and Eastern North Dakota, with groups divided by people's relationships to epilepsy, from adults with epilepsy to parents and caregivers, and now teens. Near the end of 2019, we introduced Connect Groups for teens with epilepsy after talking with parents who thought it would be helpful for their kids. For the same reason that Camp Oz is such a transformative experience for youth with epilepsy, Teen Connect Groups create a safe space for them to make new friends and meet others who have epilepsy, but who also are going through other challenges that many youth experience during middle school and high school. Now, before we move on to an overview of our 2019 financials, we have a poll question about our programs. Which programs do you enjoy hearing most about? Your options are advocacy, Connect Groups, camp programs, Shining Stars, or Seizure Smart trainings. And I recognize that your answer may be, I love them all, Glenn. I want you to do the really hard task today to identify the program that you enjoy hearing about the most. When the poll is now open for you to answer, we really appreciate you joining us today as we have a 2019 community impact review. As well, we will catch up and discuss 2020. We're going to keep this poll question up for just a couple more seconds. And once again, which program do you enjoy hearing most about? Let's go ahead and close the poll and see what our results point to. Okay. Now, this isn't a scientific poll, but I think it is very much an exciting response for me to see that a strong number of you like to hear about the advocacy that's happening not only at the state capitol, but throughout our legislative communities, as well as then our camp programs, Camp Oz, and the other program camping options that we offer to families. It's really good to hear. And then Seizure Smart Schools and Connect Groups, and then Shining Stars. So it is really an exciting time for us to continue the good work that we are doing. We are as well grateful to report that a strong 2019 has helped us immensely during this time of physical distancing and COVID-19, while many other nonprofits have sadly struggled. Last year, 73 cents of every dollar spent went directly to our programs that educate, connect, and empower people living with epilepsy. Many of those programs are things that I just talked about, like Seizure Smart trainings, Connect groups, and Camp Oz. Individual giving to the Epilepsy Foundation of Minnesota increased by 10% last year, mostly thanks to one-time gifts that will be used during 2020. Additionally, revenue from special events like the Gala and Walk increased by 10% as well. This increased generosity from our donors has been incredibly important as we were forced to make quick and drastic changes earlier this year. If you were someone who walked with us or attended the Gala, thank you. Thank you so much. Our leadership donors on the screen now are those who made a truly incredible commitment to the work we do and to the epilepsy community by supporting us with more than $10,000 in donations last year alone. Thank you, leadership donors. Your philanthropic spirit is making the difference for people living with epilepsy and their support network. The Champion Circle is a group of donors who give over $1,000 annually. These donors are steadfast supporters who attend our Gala, Walk, and other fundraisers throughout the year. Thank you, Champion Circle members. Your support helps further the work of this organization and the programs our community needs. I'd also need to take a moment and thank all those who took the step of creating a walk team, inviting family and friends to join, and raising both epilepsy awareness and dollars to support our mission. For those unfamiliar with the walks, in 2019, we had walks in Duluth, Fargo, Rochester, St. Cloud, and the Twin Cities Metro. That's a total of 5 walks that raised a combined $200,000. Thank you to all the walk captains and your walk members who helped raise such an important and incredible amount of money. It's also fitting to recognize those who volunteer and make so much of our work possible. Our board of directors, which I've been a part of myself, have done an incredible job supporting and encouraging the work we do, as well as helping plan and make decisions about the future of the Epilepsy Foundation. We would like to now recognize Matt Brokel for his time on the board of directors. Matt stepped away from the board in the middle of 2019 due to health reasons and passed away from brain cancer in February of 2020. We want to express our deepest sympathies to the Brokel family. Matt and his journey with epilepsy made a lasting impact on our organization. The end of last year marked a change of our board leadership. I'd like to take a moment to say thank you to former board president Brandon Meagle and to Vice President Rhea Nelson-Rock for their hard work and dedication. And I want to welcome new board president Patrick Burns and Vice President Tricia Zeller. We also had our executive director, Heidi Fisher, move to a new opportunity. We are thankful for her work and commitment to leading our organization to where it is today. The Professional Advisory Board is made up of healthcare professionals who advise and offer medical resources to the epilepsy community that are leveraged through information services and our education programs. Once again, thank you to our medical professionals who work hard day in and day out within their clinics and hospitals to ensure that people can get the best care possible as they move through a journey of knowing what their diagnosis is in epilepsy and improving their lives and health outcomes. Our regional advisory committees are people who live in the different communities across Minnesota and eastern North Dakota that we operate in and help our regional coordinators host events, make connections, and offer support. Thank you to our 4 regional advisory committees. Your time and commitment to our mission helps shape the work we do throughout Minnesota and eastern North Dakota. I have one final update to give in this section, and that is on the donated goods portion of our organization, which picks up used clothing and household items. From 1995 through 2019, we sold these items to the thrift store, Savers. At the end of 2019, Savers let us know they appreciated our partnership, but for strictly business reasons, they were unable to renew our contract in 2020. The good news is we have found new buyers this year, and prior to the stay-at-home Minnesota order due to COVID-19, we were on the streets picking up donations. After taking time off due to the stay-home order, I'm happy to share with all of you that our trucks are back on the roads in the Twin Cities metro area, resuming pickups. Actually, my wife saw our donation trucks just in our neighborhood this past week. So let me take a moment of personal privilege and say, if you'd like to schedule a pickup, please visit us at EFMN.org and schedule your pickup today. Now, before I invite on our program director, I'd like to take any questions you have. Are there any questions from anyone out there on our webinar? And please know that it is not required to ask the questions, but I want to make space for any questions that are lingering. You can go to, once again, your question bar that's a part of the go-to function and to ask your question. I'm going to wait just a few more seconds for a question to come in. Please don't feel like you have to ask one if you don't have one. We'll continue to move through. But not seeing one, I'd like to then shift our attention to talk about changes in 2020 and the future of what our programs will look like as we finish this year. I want to pause now again and thank you for joining us at this community forum as a chance to look back at 2019, as well as now to shift our attention to looking forward. Now, to talk about those changes we've already made in 2020, plus updates on major events like the Walk, Gala, and Expo, I'd like to welcome our program director, Nikki Baker, to spend some time with us. Nikki, it is such a joy to have you on with us. Thank you for your years of service to the Epilepsy Foundation of Minnesota. And it's so good to see you this evening. I know that we're colleagues, but everyone should know that because we are physically distancing, I don't see you often face to face. And so thanks for joining us, and we're glad to have you.
Thank you, Glenn, and thank you to everyone for joining us. I will now transition into letting you know about some new updates for our programs in 2020 here. First, I want to share about how we've adjusted our Connect groups to be completely online so that people affected by epilepsy are still able to get the support they need and not feel so isolated by spending increased amounts of time at home. Not only have we made all of our previously offered Connect groups available online, but just last week, we introduced the first Connect group for people who have lost a loved one. A lot of our program staff have been spending time personally reaching out to those we're connected to, making sure they know that we are still offering all of the services we typically do. This includes connect groups and social activities, but also information services as well, if they have questions or need support during this time. Our Seizure Smart trainings have always been available remotely and through webinars, but now we are exclusively offering them virtually and are spending our time reaching out directly to businesses, community groups, senior care facilities, first responders, and schools to let them know that we can accommodate their schedules to offer free online trainings to their staff. Moving forward, we are creating the opportunity for virtual appointments with staff members to gain further insight and resources related to IEPs, 504 plans, and information service requests. Since Camp Oz was canceled in 2020 for the health and safety of both campers and staff, we are still committed to bringing opportunities for both past and future campers to connect with others and engage in nature-related activities. These will take place through the remainder of 2020. Now to give some updates on 3 of our largest events of the year. First up is the gala. As many of you know, the gala was originally scheduled for May, and we made the decision to postpone it when it looked like the stay-at-home order was going to impact that. We have now set a new date for it, Saturday, September 12th, and have changed it to the Gala Night In for Epilepsy. Instead of bringing hundreds of people together in one spot, we are creating an in-home experience where people can invite their guests for dinner, wine, and a special digital program. There will also be a silent auction, and people can order supplies for parties of 4 or 10 people. The next big event is the annual walk, which usually takes place in 5 different locations on 2 days. This year, we're excited to expand and bring the walk to hundreds of neighborhoods in Minnesota and Eastern North Dakota. The 2020 EFMN Neighborhood Walk is on Saturday, October 3rd, and is a time for family, friends, and neighbors to unite and simultaneously walk 1.26 miles in their own neighborhoods, parks, and pathways. There is no designated meeting spot for the walk as in past years, but we will have a digital program on the morning of October 3rd so people can walk locally and rally online. With this new format, we're able to have a larger impact by walking in hundreds of neighborhoods and making it easier for people to join a team and walk where they live. Gala and walk information has been updated on our website. And lastly, the annual Educational Expo. While details are still being worked out, we are able to share that it will be an online experience beginning November 5th. We'll kick it off with a keynote address from Dr. Jacqueline French, an accomplished neurologist, researcher, and a professor who does a lot of work on the national level in terms of epilepsy research and advocacy. The following weeks will include other speakers on a range of topics from research, medication, and self-care. By spreading the expo over multiple weeks, it means greater access to topics and resources. So people are able to attend all of the sessions of interest to them. We're also able to work with a wider range of speakers and experts since travel is no longer a barrier. Does anyone have any questions about 2020 programming?
Nikki, we have a question that came in regarding access to our programs. The question is, do any individuals like access to our services such as Connect Groups because they lack a computer or tablet or access to decent internet? And what has been done, or what do you think can be done in such situations?
Wonderful question. As we do work to make sure that our services are accessible to most, if not all, we do work with individuals on what they have. And so many of our Connect Group participants do connect via a phone only and just rely on that audio. Same with the social activities and information services. We really do try to work with everyone to make sure that they can gain access.
Yeah, thank you. Thank you for that question, and thanks, Nikki. That's a great point to have audio capabilities, and I'm glad your team has thought about it. Any other questions we have from the community regarding our 2020 program, any of our event restructuring? One thing that I'll just make a plug, and I think it's important that you all hear, we value your support that you gave us in 2019, and we welcome you to, where it's appropriate, to make that commitment again this year, or to think about how you can chip just a little bit more in to gain a little bit more support from your families and friends and your corporate network and any local foundations that you know of. We really value being able to tell the story of the epilepsy community, to talk about how we're leading the fight for the epilepsy community, and are always open to engaging with our broader community and making a difference for people living with epilepsy. Mm. So, to that point, Nikki, not seeing any other questions, I want to thank you not only for being with us today, but for your continued commitment to our community. And I know that you started a walk team for the neighborhood walk that includes all of our staff. So thanks for your leadership in helping to support the organization.
Thank you.
Yeah, thank you. Well, I just want to say that I hope you're excited. You're excited to be joining us for some of our events in the future. Registration for the 2020 EFMN Neighborhood Walk is currently open on our website at efmn.org, and the Gala Night In for Epilepsy will be opening soon. I know that although we are going through tough times as a society, both in relation to COVID-19 and the injustices facing the Black community that have led to nationwide protests, I hope it is clear to you that as an organization, we are strong, growing, and committed to continually keeping the focus on people living with epilepsy. Your support has given us the ability to be nimble, continue offering crucial services that our community needs. We're not only bringing events online, but making them more available and accessible than ever before. Now, if you were able to join us for the first online community gathering we did back in April, you got the first look at a video we are about to play. I feel it's such an important reminder that we are our own kind of beautiful, and know that no matter the challenges we face, there's an entire community that is fighting for us.
This is our son, Cody. He was diagnosed with epilepsy when he was 4 years old. Since then, we've gone through misread MRIs, multiple medication changes, and unpredictable medication side effects. Cody is now 9 years old, and we've come to accept he'll likely never have full seizure control. Our family tries to celebrate life in the time between his seizures. Yet we can so easily get bogged down in battling epilepsy that we forget to enjoy our lives. We get so wrapped up in the grief, the daily worry, and the what ifs that we forget to take a break and focus on the things that bring us joy. Over the last year, we've had the pleasure of getting to know Cody's favorite musician, Jason Gray. This song by Jason brings our family joy. It brings Cody joy, and I hope it does the same for you today.
If you got a beat that's a bit unique, keep dancing to the rhythm. If you get your own thing, don't be afraid of what everybody's thinking. People will say what they want to, but pay them no mind. Darling, you're different, but who says that's something to hide? Be your own kind of beautiful. Be your own kind of beautiful. There's nobody else but you can do it like you do. Be your own kind of beautiful. Oh, 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 oh. Take it from me, you don't wanna be stuck playing someone that you're not. And if you swipe left on yourself too many times, you lose the only you got. You know that people will say anything to make you fall in line, but if you got courage to step out and let yourself shine. Be your own kind of beautiful. Be your own kind of beautiful. There's nobody else but you can do it like you do. Be your own kind of beautiful. Oh, 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 oh. If you wanna bring God glory, play your part in history, and trust what your father knew when he dreamed of you. Child, you will change the whole world just by being who you are. Be your own kind of beautiful. Be your own kind of beautiful. There's nobody else but you can do it like you do. Be your own kind of beautiful. Be your own kind of beautiful. Be your own kind of beautiful. There's nobody else but you can do it like you do. Be your own kind of beautiful. Oh, 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 oh. Be your own kind of beautiful.
You know, as I reflect on the video and see the smiling faces when we were in a lockdown, all within our homes, our hope was to make a video that brought joy to your heart. And you know, today, as we continue on in the difficulties of COVID-19 and additional areas of hardship in our communities, it's really nice to pause again and to share joy with you. My hope is that it continues to help remind us all to find our own kind of beautiful in our circumstances. And you know, as I reflect on that, and we come to the end of this community forum, and I say goodbye on behalf of the organization, and let you enjoy this very humid day across southern Minnesota and across our region, I want to affirm that your involvement with us as an organization means so much to me and to our staff. Whether you have epilepsy and attend connect groups, you schedule clothing pickups from donated goods, you make financial donations through the gala or the walk, I want you to know you're such an important member of the epilepsy community. You are the reason that every day we work to empower the fight of those living with epilepsy as they overcome challenges, navigate their epilepsy journey, and gain independence. Thank you, thank you, thank you, and have a great night.